All right, then. So let's advance the cause of development further. And we're connecting with the ideals of World Prematurity Day. And joining me on the phone line this morning, Professor Elizabeth Disu is consultant pediatrician with Lagos State University Teaching Hospital. She's also founder of Abiye Maternal and Child Health Foundation. Madam, it's nice to have you join us. Good morning, ma'am.
Good morning, Mr. Oteri. How are you?
Very, very good. So we are connecting with the ideals of World Prematurity Day, which is tomorrow, by the way. Is that correct?
Yes, every year, November the 17th,
Right.
we celebrate premature babies.
And what's the essence of that day?
The essence of the day, which is called World Prematurity Day, is to create awareness of the challenges that preterm babies and their parents have. Who are the preterm babies? They are babies that are born too soon, before their delivery date, their due dates. So they have certain problems. Yeah.
All right. So the babies that are born too soon, we're talking about babies that are born within what months?
No, babies usually in the medical palace.
Yeah, so what I'm saying, like how many months into the term?
All right. Well, maybe 7 months or so, because we use weeks
of
pregnancy, of gestation. We say weeks of gestation, which is the pregnancy date that we give. So if a baby is born before the 37th week of pregnancy, after the last menstrual period, that baby is said to be premature. That baby is preterm. And the more preterm they are, the more immature their organs and systems are. And the more they are able to cope with what we call extra uterine, when they come out of the uterus, the life that they have to. That is why we have incubators to keep them warm. That is why we have to give them IV fluids and so many other specialized care that they will need, because they are immature.
Right. So how common are preterm births in the world? And then if you bring it down to Nigeria?
Yeah, they are really very common now, because every year the number of preterm babies that are born increases. And right now, 13 million babies are born globally before their due dates. Wow. And Nigeria has quite a huge number of them as well. And it is, a problem, because it is one of the causes of newborn deaths, apart from infection and also birth asphyxia.
Right.
So premature, birth is important.
Right. So, Prof, what causes preterm birth for some children?
Yes. Preterm births are caused by a number of issues on either the maternal side or the fetal side. For the maternal side, it could be that there is injury, a mother can have infection, maybe ordinary malaria, severe malaria, anemia. A mother can have disruption in the pregnancy, probably what they call abruption. Maybe the placenta will get detached because it has a fall, or there are so many, sickness also that can cause preterm, like the mother's underlying illness, diabetes, hypertension. Some of those are also causes. Then we have causes from the fetus itself. If a fetus is malformed, maybe there is some congenital abnormalities. We're talking about problems that babies are born with that occur at the time of birth. They are probably organ problem damage, or maybe chromosomal damages. These are also causes of preterm. Sometimes we don't even know the cause. We just see that a baby is born preterm. Wow. But there are also preventable causes. That is why we always admonish mothers to do antenatal care, so that we can pick up any of these early signs, early danger signs, and then begin to deal with them.
Right. And are there signs or symptoms that would indicate to the woman that this baby is likely to be preterm?
Yes, well, if the mother has had preterm births before, we should be wary that it might occur again. Then, if mother is not feeling, if she's ill and then she's not feeling fetal movements, she should go straight to the hospital. That she's not feeling fetal movement again the way she used to feel it before. If she breaks her water and she has, like her flowing, she should go to the hospital immediately so that, they can have a scan and, begin to take care of her. So these are, and of course, if a woman is pregnant, like I will re-emphasize, we expect that the woman will go for antenatal care so that, she's taken care of, and all the problems that will cause prematurity will be detected early. But she might know from problems that she's had in the past as well.
So, Prof, what is special about premature babies that the world should really, really pay so much attention to?
Yes, because these babies are coming too early. Their organs and systems are immature. Like, for instance, they might not be able to breathe on their own, and we might have to help them to breathe or to give them some drugs that will mature the lungs faster. So a premature baby that is coming too early, we give what we call surfactants. That will help, the lungs to be able to retain air and be able to, the compliance of the lung. Then we'll also ensure that we take care of their nutrition, because they might not even be able to suck. They don't have the reflex to suck or to swallow and to be able to breathe at the same time. So we might have to either to feed them, depending on how premature they are. They might even just have to be on feeding nutrition through the veins that we have to give to them. So you see, all these are very highly specialized things that you cannot do in any hospital. So it's better to prevent the prematurity. The eyes can, also have problems. We have to ensure that we are checking their eyes so that they do not go blind. We know of well-renowned people who were blind because they were premature. So these are the problems.
Right.
Yeah.
So do premature babies live normal lives?
Yes, they can, if well taken care of. The older they are, the less the problems. The older they are before they get, that is, the older the pregnancy gets, the nearer it gets to term, the less the problem. And then we categorize them, and we know the problems that they have. Some of them, we call them extreme preterms. Those ones that are born and they're not even up to 1,000 grams. Then the ones that are born between 1,000 and 500 grams, we know that they are very preterm. And then the ones that are less than 2.5 are, the low birth weight. So depending on we categorize them to be able to know what problems to anticipate and be able to begin to solve them, or to know what complications that they might have, so that we, be able to nip it in the bud. So a lot of our babies have gone home. We recently had, day before yesterday, we had the World Prematurity Day, because it's falling on a Sunday, which is tomorrow. We decided to have the Lagos State Ministry of Health and LASUTH in, conjunction with Abiye Maternal and Child Health. We had a stakeholders meeting where there were 18 government and public hospitals and 2 private hospitals, big ones, that take care of premature baby. And we came together. We looked at our, statistics, our audits for the past 1 year, and we were able to say, brainstorm and say, this is, the latest is. We gave an update. We know what are, the causes of death among those ones that are dying. How many of them are dying? Why are they dying? So we, are seeing improvements. We are, because this year's theme is 13 million babies born too soon. Okay. Access to quality care everywhere. So everywhere that there are premature babies, we want to access quality care. So we are saying that doctors are not supposed, we have what we call the referral system. where you have to refer babies, upwards to secondary or tertiary, depending on that categorization, as I said.
Okay.
You know what you can handle. Yeah. If you're in the primary center and the woman is coming and she is not, up to 10, you know that you have to refer her to a secondary center or a tertiary center where they can take care of her. So all this, is giving us good results. The quality care is improving.
Right.
And we are beginning to look at those things that will cause infection and prevent infection and also prevent other complications in them. So it's been very worthwhile. For the past 8 years, we've been doing this.
All right.
And we are seeing results.
Which is very, very good. Lagos Traffic Radio 96.1 FM. We're connecting with the ideals of World Prematurity Day. Well, if you're out there, you are a mother, and you give birth to any of your children preterm, as a premature, as the case may be, you might want to connect with us. You can share that experience with us right now. 08099120777 and 09153877127. If you want to ask the Prof any question, feel free to do so as well. Traffic-wise, things are still looking relatively cool and calm out there. If you want to make the journey to the island, the connecting points are still very good. Lagos Abiye Expressway, Lezik towards National, looking good at this time. Also, all the way down to Oshodi. All right, some questions are coming in here for you, Professor Disu. This one says, good morning, Traffic Radio. Does stress during pregnancy affect the risk of prematurity? Sophia is sending that one in.
Yes, stress during pregnancy can affect the psychological stress or physical stress can affect a woman, can affect our health. And anything that affects the health of the pregnant woman can make her baby come too soon. So definitely stress can.
Okay. This one says, good morning, Victor. Please ask your guests if premature babies catch up developmentally with full-term babies. Buki from Oshodi, sending that one in.
Yes, of course. Thankfully, they do catch up. And some of them even do very, very well. So we are grateful for that there is a catch-up period and they have the normal milestone. And before the age of 2, we follow them up, trying to see their developmental milestone. We look at them according to the corrected age. That is, we take into cognizance the number of weeks that they had come too soon, add it up to their minus it from their chronological age, and see where they should be. And it's adding up to the original, so we know where they should be, and we know what developmental milestone that they should have at that particular time. So a baby that is born too soon, if it's born too soon, maybe by 6 weeks, you cannot expect that baby to be doing the function of a baby that was born appropriately. So you remove that 6 weeks to be able to say, well, you probably will be holding up the neck at the time is chronologically 4 months instead of 3 months.
Right. All right. So, Prof, I know you've been doing this or caring for babies or these preterms for how many years now?
Oh, for over almost 40 years now.
40 years.
We have been the doctor. I've been working in specialization over 25 years.
And I'm sure there'll be some very, very touching stories that you must have had over these years.
Yes, particularly now, we have had touching stories because when there are multiple pregnancies, which is happening now with the increased awareness of in vitro fertilization, and people are our colleagues in the O&G are helping mothers who have not had babies to have babies. Sometimes we have triplets, quadruplets, and even quintuplets. We've had 5 babies born, and they were born preterm, and they all went home. That has been very touching. Right. We've had people who have not had babies for maybe 15, 20 years, and already advanced in age, and then they utilize the new technology for delivery for birth, for getting pregnant, and they come and deliver. And those babies are really very precious. We are happy that, they survive and go. We've had babies as small as 600 grams.
Wow.
Go home. But, like I said, the lower their birth weight, the lower their gestational age, the more problems that they can have, the less the survival rates. But we are happy that those extreme ones that are less than 1,000 grams, we are, they are surviving better than before.
All right. There's a question here. It says, please, Ma, what is the survival rate for extremely preterm babies?
The survival rate for extremely preterm babies depends on the facility, depends on available the facilities in terms of available equipment that you have. If you don't have an incubator to keep them, they will not survive. So you cannot categorize. We have read in literature that babies that are born at 22 weeks, which is about less than 5 months or thereabouts, to survive in advanced countries. But here, at least we can say that our less than 1,000 grams are having a better chance than before. So I cannot give a particular rate or percentage because it cuts across whether you are tertiary, secondary, or not. But on the average, the average is getting better and progressively so.
All right. So, Professor Disu, for young mothers, they've never given birth before, and they've been so expectant. The couple, they're so happy, and all of a sudden, it's time for delivery, and they now find out that it's a preterm. This must be disappointing to such a mother.
They should not be disappointed. They should not be disappointed. They should not worry. They should just make sure that they get the right medical attention and go to a specialist for specialist care where preterm can be taken care of. The tertiary hospitals in Lagos, we have LASUTH, we have LASUTH, we have Federal Medical Center, we have private hospitals too. They might be expensive in the private hospitals. Even anywhere at all, the costs can be high, but there is hope. They can still survive. Many babies are surviving as preterm babies. In fact, we are delighted to see babies that were preterm who are now become big adults in schools. And a lady, the Tunis Creations, owned by one good-hearted lady, Elizabeth Okeyele, is teaching these babies how to knit. So they are knitting caps, mittens, and socks to keep preterm babies warm so that they can survive. Isn't that wonderful?
It is.
So you can see babies who are already, grown up, learning to ensure that their other preterm babies, their colleagues, also survive. It's been very heartwarming.
All right.
So there are so many interventions, even at the federal level, state level. There are budget heads for the newborn now at the federal level. At the federal level, over at the state level, Lagos State is doing a lot too. We're teaching people at the grassroots essential care for the newborn, which includes skin-to-skin care to keep these babies warm, which includes how to feed them early and make sure that they survive. So a lot of things are happening.
All right.
There is hope.
Right.
For the preterm.
This one says, good morning and happy weekend. It said, are there long-term health concerns for children born prematurely? Festus is sending that one in.
That's a very good question. Thank you very much. Yes, there are long-term health problems for those that have not been fortunate enough to get good care. For instance, we do routine screening, eye screening for them to look at the retina, because they can have retinopathy of the premature babies that can cause to blindness. That is one health problem. They can have lung problems because often they are put on maybe ventilator machines to help them breathe, and that's with oxygen that can cause a side effect, and they can have breathing problems as well. That they have to depend on drugs and care later in life.
Right. So let's begin to round this off right now because of time. But this question coming in says, what steps can expectant mothers take to reduce their risk of preterm delivery?
Well, not in terms of taking good nutrition for every mother. Yes, good nutrition, balanced diets, ensuring that they have adequate rest, ensuring I cannot overemphasize the fact that they have to attend antenatal care to ensure that everything is coming on well. Because if they have raised blood pressure, if they have urine infection, if they have anything that can jeopardize their health, it can jeopardize that of the baby. So we don't want any of that. And early detection and treatment is key.
All right. So as we celebrate World Prematurity Day, what should we be reflecting on and how should it be celebrated, Professor Disu?
So we should celebrate those mothers, because it is not easy to have a premature baby, because sometimes they have to stay in hospital for weeks, sometimes a few months, that for their resilience in caring for their babies. To celebrate the doctors who work, to celebrate even those babies who have a fighting spirit to survive. So we remember premature babies, and we want to support them as government, as individuals, to do all they can to support premature babies or those taking care of them.
All right, then we'll leave it at that.
And their healthcare workers.
We'll leave it at that for now. Thank you so much, Professor Disu, for connecting with us.
Thank you.
Okay, then.
Thank you for having me.
Wonderful. Professor Elizabeth Disu is a consultant pediatrician with LASUTH, Lagos State University Teaching Hospital. She's also the founder of the Abiye Maternal and Child Health Foundation. And she's been talking about the significance of the World Prematurity Day. We have to go. Dio Anthony has produced the program this morning. Maximum thanks to you. Of course, Afe John is of our social media unit. Same for Kwame Children Care. Our executive producer is Tayo Akonle. My name is Victor Oteri. Have a great day. Bye.